If your legs feel weaker than they did a few years ago, do not make the mistake of blaming everything on age. Yes, muscles naturally change after 60, but weakness, cramps, numbness, poor balance, and difficulty standing can also come from low activity, inadequate protein, medication effects, nerve conditions, circulation problems, and sometimes nutrient deficiencies. Random supplements are not the solution. The smarter approach is to know which nutrients matter, who is likely to be low, what warning signs to notice, and when to see a healthcare professional. In this video, we'll cover 3 vitamins often discussed for nerves, muscles, and bone health: vitamin B12, vitamin D, and vitamin K2. None is a miracle cure, but correcting a real deficiency can support better movement and safer walking. Stay until the end for the biggest mistake many adults over 60 make: focusing on supplements while ignoring habits that preserve leg strength. Let's begin with vitamin B12. B12 plays a major role in the nervous system and in making healthy red blood cells. Your legs move because your brain, spinal cord, nerves, and muscles communicate. When that communication is disrupted, legs can feel heavy, numb, weak, or unsteady. Low B12 can cause tingling in the feet, burning sensations, reduced balance, unusual fatigue, or difficulty walking a straight line. These symptoms are not just getting older. Adults over 60 are more vulnerable because the body may absorb B12 less efficiently. Risk is higher with a strict vegan diet, stomach or intestinal conditions, digestive surgery, or certain long-term medicines. Some acid-reducing and diabetes medications can affect B12 levels. That doesn't mean you stop prescriptions. It means your doctor may need to monitor levels if you have symptoms or risk factors. B12 is found in fish, eggs, dairy, meat, and fortified foods, but eating these foods doesn't guarantee absorption. Guessing is a bad strategy. If you have persistent tingling, numbness, balance problems, memory changes, fatigue, or unexplained weakness, ask whether a B12 blood test is appropriate. If supplementation is needed, the correct form and dose depend on the cause. Some people respond to oral tablets. Others need higher dose treatment or injections under medical supervision. There's no universal rule to take B12 at night. Take what fits your dose, tolerance, and follow-up testing. Now vitamin D. Vitamin D supports bone health and muscle function. Adults with very low vitamin D may have muscle weakness, aches, slower movement, and trouble rising from a chair. Low vitamin D is more likely if you spend little time outdoors, cover most of your skin, have darker skin, live in low sunlight areas, have digestive problems, or have kidney or liver disease. Body composition, diet, and some medications also matter. For people over 60, muscles and bones work together. Strong muscles help prevent falls, and healthy bones reduce harm from a fall. But more vitamin D is not always better. It's fat-soluble, so excessive intake can build up and cause harmful calcium changes, kidney effects, and heart rhythm issues. Don't copy a large dose from a video or social post. A blood test helps determine if your level is low and whether supplementation is appropriate. Your clinician will consider age, diet, medical history, kidney function, medications, and current vitamin D level. Food sources include fatty fish, egg yolks, and fortified products. Sunlight can help, but safe exposure depends on many factors. There's no proven rule that vitamin D must be taken before bed. It's often taken with a meal containing fat to improve absorption. Consistency matters more than clock time. If it affects sleep, change timing. Vitamin D may support muscle function when levels are low, but it does not replace resistance training. Next, vitamin K2. Vitamin K is involved in proteins that support normal blood clotting and bone metabolism. K1 is mainly in leafy greens. K2 is in some fermented foods, cheeses, eggs, and animal products. You may hear that K2 directs calcium into bones and away from arteries. That's a simplified view. K activates proteins involved in calcium regulation, but it is not a cure for blocked arteries, joint pain, or rapid muscle rebuilding. Evidence about K2 and long-term bone or cardiovascular health is still developing. It may help in specific situations, but it's not a universal treatment. Important safety note: if you take warfarin or other blood thinners affected by vitamin K, do not start, stop, or change K supplements without consulting the clinician managing that medicine. Sudden changes in vitamin K intake can be dangerous. For most people, a stable diet with vegetables and varied whole foods is more important than chasing a single supplement. And no, K2 does not have to be taken before bed to work. So should every adult over 60 take B12, vitamin D, and K2 every night? No. That advice is too broad and can be unsafe. Some adults need one of these nutrients. Some need none. Some need medical treatment for a different cause. Leg weakness can come from arthritis, spinal problems, peripheral neuropathy, stroke, Parkinson's disease, poor circulation, anemia, thyroid disorders, diabetes, heart or lung disease, medication side effects, dehydration, infection, or loss of muscle from inactivity. It can also be urgent. Seek immediate care if leg weakness appears suddenly, affects one side, or is accompanied by facial drooping, speech difficulty, severe dizziness, chest pain, shortness of breath, loss of bladder control, severe back pain, or inability to stand. Don't wait for a vitamin to fix an emergency. For gradual weakness, arrange a medical evaluation if the problem is persistent, worsening, causing falls, or limiting daily life. Assessment may include medication review, strength and balance testing, blood tests, nerve exams, and evaluation of the heart, circulation, joints, and spine. Now the habits that actually protect leg strength after 60. Pillar 1. Resistance exercise. Walking is useful, but walking alone may not maintain muscle. Simple movements, sit to stand, supported squats, heel raises, step-ups, and resistance band exercises, train thighs, calves, hips, and glutes. Start safely and use support if needed. If you have severe balance problems, chest symptoms, recent surgery, or significant joint pain, get professional guidance. Pillar 2. Protein. Spread meaningful protein across meals. Eggs, yogurt, fish, chicken, beans, lentils, tofu, cheese, tailored to your health. People with kidney disease need individualized advice. Pillar 3. Balance training. Practice controlled heel-to-toe walking, supported single-leg standing, slow direction changes, and safe step patterns near a support surface. Pillar 4. Hydration. Dehydration causes fatigue, dizziness, cramps, and low blood pressure, but fluid needs vary with health conditions and medications. Pillar 5. Sleep. Good sleep supports recovery, energy, and balance. Build routines, reduce late caffeine, and seek help for snoring or daytime sleepiness. Pillar 6. Medication review. Some medicines cause dizziness, low blood pressure, sedation, or muscle pain. Never stop prescriptions on your own. Ask your doctor or pharmacist to review all medicines and supplements. Natural doesn't mean harmless. A practical plan. Step 1. Identify symptoms. Are legs weak, painful, numb, stiff, shaky, or easily tired? Are both legs the same? Sudden or gradual onset? Falling, dragging a foot, or struggling to rise from a chair? Write details down. Step 2. Review risk factors. Do you eat animal products? Take metformin or acid-reducing medication? Spend little time outdoors? Have stomach surgery? Take blood thinners? Recently become less active? These details help clinicians choose tests and treatments. Step 3. Do not start 3 supplements at once. Starting multiple products makes it hard to know what helped or caused side effects. Test and decide one evidence-based step at a time. Step 4. Strengthen legs safely. Try a basic chair rise test near support. Sit in a firm chair, feet under your knees. Lean slightly forward. Stand using your legs if safe. Then sit down slowly. If this is difficult or unsafe, a physical therapist can help. Step 5. Measure progress realistically. Track changes over weeks. Easier chair rises, steadier walking, fewer pauses on stairs, less fear of falling, or more confidence. Real progress is gradual. Final message. Weak legs are not something to ignore, but they are also not a reason to panic. Aging changes the body, but decline is not always fixed. Strength and balance can improve. Nutrient deficiencies can be treated, medical causes can be identified. The answer is rarely a secret nighttime vitamin routine. The answer is accurate diagnosis, appropriate nutrition, regular strength work, safe balance training, good sleep, and medical follow-up when symptoms appear. B12 matters most when nerve symptoms or absorption problems exist. Vitamin D matters when blood levels are low or bone and muscle health are at risk. Vitamin K2 may have a role in specific circumstances, but it is not universal and requires caution with blood thinners. Do not take supplements because a video frightened you. Do not avoid medical care because someone promised a natural fix. Do not assume weakness is normal simply because you are over 60. Use information as a starting point, not a prescription. Speak with a qualified healthcare professional if you have chronic illness, take several medications, have fallen recently, or notice worsening weakness. Your goal is not to collect more bottles. Your goal is to stay mobile, stable, independent, and confident. And that begins with one honest question. What is actually causing your legs to feel weak?